Organization. We welcome you to this remote and person session with the Ministries of Health, national offices, and regional offices from PAHO on our Universal Health and Preparedness Review for Emergencies and Disasters. First of all, we would like to thank each and every one of you for you being here, and also to thank the UNHPR Secretariat from the World Health Organization for the support in organizing this session. Next, please. This meeting has two goals. First is to present the Ministries of Health on relevant information regarding the universal assessment, aspects regarding objectives, the nature and scope, and also to share the methods employed by the package created for pilot studies, and to share with you real aspects on assessment begun in 3 countries. Next. Next, please. First, we will begin with the session's agenda by welcoming words from Dr. Ciro Ugarte, the Director of the Emergency Health Preparedness Office from the Pan American Health Organization. Go ahead, Doctor. Can you hear me? We'd like to confirm that you hear me, please. We can hear you, Doctor.
Well, it's a great pleasure to have everybody here, the colleagues from Geneva. I see Estela. Hi, Estela. Great to see you.
Hi, good to see you too.
Mike, how are you doing, Mike? Thank you for joining this meeting. Thank you so much. And also to welcome all our member states, all the participants from the countries. It is a great pleasure to host this meeting because we have been looking for some time already to have a conversation with the member states. We did have an introduction with our country officers regarding the UHPR. And as we saw during the discussions of the proposed amendments on the IHR this week, we saw that there is some, approaches regarding all the evaluations that we are looking for in terms of what is the capacity of the countries. And this is crucial for us to understand all the tools, the methodologies, where we are coming from, and at the end, what we are looking for, both at the national level, but also at the global level. There are several aspects that what we say, the lessons that we must learn from the pandemic, but also from other large emergencies. The last step is to ensure that the countries themselves, both at the national, subnational, and local levels, have the right capacity to early detect and initiate the response. And of course, at the international community also looking at those capacities to complement the efforts of the member states. So it is, for me, it's a great pleasure, a privilege to have Mike, to have Estela, to have so many colleagues joining this session. And thank you, Celso, and also our colleagues from health services to coordinate this session, and welcome to this meeting. I'm seeing that this will be a very fruitful meeting. Thank you so much. Over. Thank you, Celso.
Muchas gracias, doctor. Continuando con la agenda de la reunión.
Thank you so much, Doctor. Moving along with the agenda.
Good morning. Go ahead. Dr.
Mike, yes.
Oh, me. Okay, sorry. Yeah. sorry. Excuse me. I was listening to the interpretation, and I didn't hear my name. And thanks, Dr. Celso. Particularly nice to see you again, Ciro, and thank you to the whole team in PAHO and to the member states who join us this morning, and your interest in this really important process. Samir Asma will join us later in the session, I think, or Samir will be already online. So we work very closely with the DDI initiative on this, and Stella Chungong is online, who leads the Health Security Preparedness Program, and all her people who do all of the core work around the UHPR process. I think the vision of Dr. Tedros, and again, this was a process that was very much proposed by member states in the beginning. It was member states who came to Dr. Tedros and says, hey, why don't we try and look at another supplemental way of looking at our systems? And the thing that was sort of missing at that time, lots of assessments, we have JEEs, we have after action reviews, exercises, we have the self-assessment reports on the IHR, the SPARS, and all of that's very useful. Ministries of health and national public health agencies able to examine and assess and identify gaps and weaknesses in their systems, and even create national action plans around that. But it was really felt that we needed, and Tedros felt after these conversations with some key member states, that we were missing something. We were missing a really multi-sectoral, all of society way of looking at all of those assessments, looking at all of those gaps, and creating a higher level of political engagement, societal engagement around those gaps. So that we create more commitment at an all of government level, more commitment from communities, the public, the private sector, so that these plans would have more life, would have more opportunity for being sustainably funded, would have more public recognition. And in doing that, trying to create a mechanism where we bring member states within a member state to bring everybody together to have that discussion around the gaps, around the opportunities, around the investment needed, around the multi-sectoral nature of the threat, around the fact that we must prepare for many emergencies at one time. And PAHO knows more than anywhere, because you've led the world in multi-hazard management, in disaster risk management, where governments not only plan for pandemics, but they have to plan for floods, for earthquakes, for wind events, for conflict, unfortunately, as we've seen in the region over the last number of years. So having a multidimensional, multi-sectoral process by which all of society and all of government prepare for existential crises was very important. So UHPR as a concept was primarily aimed at providing a mechanism, a methodology by which the highest level of government could bring everybody together to have that discussion. And secondly, the hope was that after those national discussions, the member states could reach out to each other and work together in a peer-reviewed mechanism to describe their challenges, to describe the opportunities, to describe the investments needed, so that we could have more peer-to-peer, country-to-country partnership and solidarity on building health emergency preparedness and response at national level. So as such, UHPR has developed as a pilot approach, taking the ideas first of the member states, looking at how that could be operationalized, and then having 5 countries pilot this. And really, it's thanks to the countries, Stella, I'm sure Stella will agree, and others, that it really has been the countries piloting this who have proved so much around what works and what should work better and what doesn't work so well. So the process is evolving the methodology, and the involvement of the member states in being co-creators of that method, because there is little point having a UHPR process that our member states do not own and do not feel that it is the product that they need in order to look at their systems or to engage with other member states. So the aim of the UHPR is to build solidarity, to enhance mutual trust, to build cooperation and strengthen national capacities for health emergency preparedness and response. What's unique about it is that it seeks to move that engagement to the highest level politically within countries and between countries, but complements those other assessments and other planning processes that go on in the different sectors that go on for different threats. It is fairly unique in that way, but it's not standalone. And that's, in other words, there's little point doing UHPR unless you're doing other forms of measurement at country level. But in a sense, is UHPR could be seen as the capstone, the roof on the house, the way you build a foundation of assessment and knowledge of the system and your ability to look at the gaps in disaster risk management operationally and technically. you build a broader assessment of what's going on and the needs, you make plans, but at some level, to put the roof on the house, you need to bring together governments and multi-sectors of government and others to discuss how that's going to be achieved. So we would see, I think, and again, Stella, you can stop if you think I'm wrong, but all of the monitoring and evaluation, the SPARs, the GEs, the interaction reviews, the after action reviews, really are on a pathway ultimately to the whole society agreeing on what needs to be done to improve preparedness. There is a missing piece still because we're piloting the national part of the process. Again, I believe we have ideas and plans for how we would test the peer-to-peer part of that process and have a more international component. That's still a work in progress. And again, something that I think the member states have to build together. There is no compliance component on this. This is not an oversight mechanism. It shall never be an oversight mechanism. This is a peer-to-peer solidarity mechanism, a peer-to-peer discussion mechanism, and the member states will fully define what the nature of that engagement is. The UHPR process at the end of the pilot, it will be for the member states, and member states are already discussing this within both the IHR revision process and the IMB process. And I want to reassure member states here that the UHPR will not be an imposed process. And whatever happens at the level of international governance, any long-term implementation of UHPR will be under the governance of the member states of WHO and by extension the member states of Pan American Health Organization, and can only really have a long-term future within the context of the IHR, the IMB, and the broader governance of global health security. With that, I will give the floor back just to reiterate our support for the process. Our thanks to Cyril, to Jarvis, the regional director, and the whole teams there for the work you do. Again, PAHO and AMRO have led the way in multi-hazard risk management over many, many years. I've learned a lot from my colleague Cyril over the years on that. I think this is an opportunity for countries in the Americas to actually demonstrate that to the world, that the countries of the Americas not only have a lot to offer to each other, but actually have a lot to offer to the world in the broadest sense of multi-sectoral emergency risk management going forward. And I would hope that the countries of PAHO will be able to share that with the world through a peer-to-peer mechanism like the UHPR as one of the ways of doing that. So thank you all. We do need to have some urgency in the work we do. The next pandemic could be a day away. So working together diligently and immediately to try and build mechanisms like UHPR is very, very important. So I thank you all for your attention, and back to you, Dr. Surson.
Thank you, Thomas Ryan. Continuando con la agenda de la reunión, vamos a pasar a las partes.
Moving along with our agenda, we will now move on to the part where we will present UNHPR issues, and having finished all presentations, we'll hold a space for countries to directly participate by taking the microphone or putting forth questions via chat. We are now move over to World Health Organization presentation.
Thank you so much, moderator. Thank you so much, also Cyril. And thank you to the PAHO member states for joining this, meeting on the UHPR. The aim of this particular presentation is to give you some background on the UHPR, and also after that we'll go on to listen to the countries that have piloted the experiences. And we have today Central African Republic, Thailand, and Portugal. Unfortunately, because of the aid, Iraq could not join. So if you can put on the presentation on the next slide, please. Next slide, please. So what is the purpose of the UHPR? Dr. Ryan talked a lot about this. It is a member states to member state review mechanism and dialogue that looks at the country's governance, at the agile and coordinated national systems, but also seeks to establish more predictable and sustainable financing for health emergency preparedness and health security. It builds on the key principles of solidarity, of transparency, and mutual accountability, which engages national and global stakeholders on health emergency preparedness, health systems, as well as universal health coverage. It prioritizes the country's goals in serving the needs of their population and in line with the full implementation of the international health regulations to reduce the international spread of diseases. The UHPR provides a really holistic platform for dialogue on national priorities between senior policymakers and the relevant sectors, investing in sustainable preparedness, aligning to regional and sub-regional and global initiatives, as well as fostering that mutual accountability and trust between all stakeholders, both within the country, but between the member states. So, as you know, these discussions are also ongoing within other global discussions on, such as the intergovernmental negotiating body, such as the IHR working group, but also around the health emergency preparedness, response, and resilience architecture. Next slide, please. So if we think about this, it's five steps in the process. The first step is around the preparing of the implementation through engaging the highest levels of political authorities as possible within the country, who will take the lead on the process. The second phase is around actually conducting a review of the various countries' capacities, whether it is through your voluntary external evaluations, for those who have done those, the joint external evaluations, the state parties' annual reports, simulation exercises, interaction reviews, after action reviews, and other assessments that exist in the country. And this review then yields the priorities and key recommendations that have come out of the various processes that have already occurred in a country. The third stage is around drafting a national UHPR report, which has been developed from all these existing mechanisms in the countries, and identifying the best practices, the gaps and the challenges, as well as the priorities in terms of capacity building for health emergency preparedness and response and resilience. And then this national report is reviewed through a whole multi-sectoral, whole of society perspective that brings different sectors to be sure that it does reflect the true capacities across multiple sectors, but also across the whole of societies, including the communities in this report. The next phase is the global review phase, and I'll talk about that in a little bit more details in my subsequent slide. And that comprises mainly of an expert review commission and a peer-to-peer, member state to member state discussion and dialogue that is based on solidarity and support to member states. The last phase is around bringing all these priorities and through these global mechanisms to bring actions to these priorities in terms of capacity building, in terms of leveraging resources, in terms of financial and human resources, and other ways that can be identified to strengthen the country's capacities. Next slide, please. Next slide, please. So this is really, as has been emphasized, a country-led, multi-sectoral mechanism that creates that enabling environment that will allow the implementation of the international health regulations and other national obligations, and also bring around that global solidarity to strengthen the systems and governance and capacities within the countries. In particular, at the country level, we have seen that the UHPR helps to establish and sustain improved levels of cross-sectoral mobilization and dialogue, bringing together key stakeholders from various sectors to prioritize actions and address areas that require immediate attention. All of these are really important in terms of how the national action plans, whether it's for health security, for the international health regulations and other action plans, are prioritized and funded and costed and funded, but also how national investments planning can be built around key priorities of the countries. Next slide, please. So, next slide, please. So that review process, as I mentioned, does involve that national component and report, which then goes to an advisory expert commission. And here the proposal is a regional advisory commission that would bring together the experts in a region who have got the experience and who have got the knowledge about the specific regions to be able to support and discuss the key findings from the national levels. And then there is a global peer-to-peer mechanism that it will occur in terms of discussions between member states seeking to identify key recommendations that would be in support of the member states. Next slide, please.
Excuse me,
so,
can you speak slow for facilitated interpretation, please?
Sure, I'm sorry about that.
Thank you.
So next slide, please. So in terms of the added value, we've received this question a lot around what is the added value of the UHPR over the existing processes. And we will be having the countries themselves that will be talking about this, but just to highlight that the UHPR mobilizes the highest political levels and engagement in a country, which is often missing when we deal with, when we talk about the standard processes we have in countries. And therefore, this gets the attention that it deserves of the highest priorities, reaching the highest levels of governance. Another key added value is that of the sustaining of the multi-sectoral and cross-sectoral dialogue that occurs during the UHPR, that brings stakeholders from various sectors, but also that whole of society perspective that brings in communities, that brings in private sectors, that brings in parliaments, that brings in academia, that brings in such a wide scope of stakeholders to have a discussion and come up with key priorities within the countries. There is also that notion of sustainable domestic financing, and that is including the mapping and identification of resources within the country itself, but also identifying the international support that can be sustainably leveraged towards addressing the gaps in the countries. So last but not the least, there is the whole area around the partner engagement and using the conclusions of the reports to further engage partnerships that would align and support national priorities. In terms of the global added value, this promotes that dialogue between countries at the global level, as well as that peer-to-peer learning process that is critical for countries in terms of learning lessons, in terms of providing support, but also in terms of technical cooperation that might occur between countries. Next slide, please. So another question that often comes up is around what is the difference between a JE or a VE, a voluntary external evaluation or joint external evaluation, and the UHPR. So just to touch on this very quickly, the joint external evaluation is really a technical evaluation. And even though it is multi-sectoral self-assessment, there is a self-assessment component as well as that component of having a sort of peer review. But this is at the technical level without that global perspective of solidarity, without that global perspective of the highest levels of engagement. Many countries have conducted joint external evaluations. Many countries have done their states parties annual reports, and I believe in 2022, every single country in the PAHO region submitted a states parties annual report. But many countries still do not have those gaps financed, funded, and implemented. And this brings, therefore, the UHPR takes all of this and brings it to the highest level within the countries, but also globally. The UHPR, and again, it's just an overemphasis probably, really then moves and builds on all of these data that are within the country. It does not duplicate the data collection system. During the UHPR, nobody goes into a lab or nobody goes into to look at the kinds of things that the JEE, VEE, or the state SPA reports and looks at. But it looks at the recommendations from all of these, looks at the interdependencies, looks at the health systems, brings together that as well as that whole multi-sectoral aspect. Next slide, please. So just to touch then back on what practically at the country level is being done. It's a two-step process at the country level that takes about 12 weeks. It's proposed to take about 12 weeks to do this. It is around establishing or repurposing a multi-sectoral technical secretariat that brings together different sectors, whether it's the agric and One Health sector and other relevant sectors, to already start then having discussions around what assessments and evaluations exist within the countries, what recommendations are there, and pulling these together, whether it's the humanitarian plans, the national action planning for health security and other plans, pulling these together into a coherent package of priorities for the countries. It also requires the establishment of a multi-sectoral national commission, which is above the Ministry of Health level, that would then serve to be the commission that would serve as the national commission that would oversee this process, but also be the link and with the global processes. And then there's a recommendation to actually conduct a technical simulation exercise that would help to look into the issues around governance, around coordination, around funding for health emergencies. And then this would result in everyone coming together and having a discussion with that whole of society perspective to draft a national report. The second part during the pilot phase is around the highest levels of engagement between a team, an external team, and the government that then comes to build and strengthen and support the country in that highest levels of engagement, talking to the prime ministries, where to the heads of governments, to the UN where they exist, to the parliaments and others within the countries, working with the different line ministries, coming up with discussions and having discussions with the civil society organizations, academia, private sectors, others, and then meeting with relevant UN and other partners within the country. And these will feed then into that draft report, the recommendations. The country then takes about a month to finalize that and submit that to the global commissions. And again, the key areas that we're looking at and things that prior tools did not look at were issues around governance, around systems, around financing, but also around risk and risk-informed management of preparedness and response. Next slide, please. So what is the progress to date? In terms of, a lot has been done since the member states approached the DG. And in terms of that, the big milestone was that of the noting of the concept note on the UHPR at the Assembly last year. And since then, we have had 4 countries that have undergone a pilot, and we'll be hearing from some of them today. And these pilots have been used to inform and update the current tools that we have. We have also a technical advisory group from all our regions, all the WHO regions, including the PAHO region. And this technical advisory group provides technical advice and support to the implementation of the UHPR. We have had a number of meetings. The last meeting was just last month with the participation of all our TAG members to review all these documents and processes that we have talked about. We will be having member states, we've kept them regularly informed, and we will continue doing so through information sessions and consultations. We have also noticed that a huge number of member states have been quite supportive of the UHPR process, and there is a growing indication of the importance of preparedness and response in health emergencies that attest to this. Of some of our regional committees, including the Afro, EMRO, and CIERO regional committees, have acknowledged the importance of the UHPR in strengthening their health systems. Civil society organizations have also been briefed on the UHPR, and we've had consultations with them, with the most recent one being around the 24th of January, and they are requesting more guidance in how countries approach this from a CSO perspective. So next slide, please. In terms of the way forward, we have got a number of countries that have asked for a pilot in the coming, in 2023, and these include the Sierra Leone, which will take place from the 2 to the 4th of May. The work has been done 12 weeks before, as I explained in my previous slide. There are expressions of interest from other member states, and we have the Dominican Republic, we have Bahrain, we have Kenya and Rwanda. In terms of the pilot results, we are using them to continuously update the processes and the tools, and we are hoping that we'll be able to also pilot the global peer review phase in the coming months. There will be a member states consultation session on the 27th of April, led by member states, and I am sure all of you will be invited to be part of this. So I think I'll end here. My last slide is around the documents that are available. Next slide, please. And it's the last one. The various documents that are available in terms of references that you can kindly refer to. And we've got a website, and the link is there. Please feel free to go on the website. This is a pilot process. We are open to receiving feedback from all of you, whether it's on any package you read on the website. We are open to listen to what you think, and it's a member state-led process, and we thank you for that leadership that you are showing. I thank you, and back to you, moderator.
Muchas gracias, doctora Estela, por su presentación. Simplemente recordar que tenemos disponible.
Thank you very much, Dr. Stella, for your presentation. We have shared the versions in Spanish, English, and French of the technical package of UHPR. We are now going to begin with the presentations of the experiences that were carried out in the pilot countries. We're going to start with Thailand, then the Central African Republic, and then finish with Portugal. So we'll go ahead with the Thailand presentation.
Vamos a reiniciar la presentación de Tailandia que está grabada debido a que había problemas en el sonido. Disculpe, muchas gracias.
We're going to restart the presentation from Thailand. It's a recorded presentation, but we had audio problems.
Thank you to the organizers of this meeting for having me today. I am Dr. Chavesan Namwat, representative of UHPR Working Group, Department of Disease Control, Ministry of Public Health, Thailand. I apologize that I am unable to join this session live, so I am presenting this as a pre-recorded video. In this talk, Experience of Thailand in the implementation of UHPR, I will provide an overview of activities since the beginning of preparation, during the mission week, and afterward. And I also will mention about the added value and challenges that were encountered. In year 2021, Thailand Ministry of Public Health committed to participating in the pilot UHPR. A working group of core team was formed under the leadership of Dr. Soponiam Sirithawon, Deputy Director General of the Department of Disease Control. Regarding the political preparation, we informed the Deputy Prime Minister and the Public Health Minister. We also reported at a meeting of the National Center for COVID Situation Administration, which functioned as the National Public Health Emergency Management and was chaired by Prime Minister. Representatives from the different sectors in the center were informed and invited to join the UHPR activities by formal letters afterward. Regarding the technical preparation, the core team that set informed the National IHR Committee and coordinated the stakeholder in public health and non-public health. The team worked with the WHO expert team in preparing the list of topics in simulation exercise included information, risk communication, public communication, essential health services, vaccines, and point of entry and quarantine. Regarding the logistic preparation, Department of Disease Control, Ministry of Public Health work closely with other department and support from WHO country office. Identify the mission week we schedule in April, just after the long holiday in Thailand. Unfortunately, the peak of the Omicron was continued since January 2022, resulting in a hybrid workshop where some participants were able to attend virtually to maintain social distancing. What happened during the UHPR pilot or high-level mission? We scheduled the mission week in April, on April 21st to 29th. The opening ceremony was chaired by His Excellency, the Deputy Prime Minister and Public Health Minister. There were 6 high-level advocacy meetings, which included representatives from the meeting of Ministry of Labor, Ministry of Higher Education, Science and Innovation, National Health Security Office, Thai Health Promotion Foundation, and the Office of Social Security. 13 sites were visited, 2 simulation exercises were conducted, and 29 key informants were interviewed. Furthermore, we held focus group discussions with over 80 participants. And on Friday, April 29th, the debriefing was chaired by His Excellency Deputy Minister of Public Health. What happened since UHPR pilot and what are the next steps? Since the pilot in Thailand, there was a press conference held by the Deputy Prime Minister and the WHO representative to Thailand, which helped to gain the people's trust in the public health system. The process of writing of the UHPR report at the national level was initiated, and we shared our experiences at the regional level and in the WHO UHPR STAC meeting. The next steps included a global peer review and updating the National Action Plan for Health Security to ensure sufficient budget and funding for the implementation of the identified priorities and recommendations. Value of the UHPR includes providing qualitative information on strengths and gaps in selected topics, engaging with both public health and non-public health sectors extensively, strengthening the function of the National IHR Committee and its subcommittees, achieving success in policy advocacy across various ministries and institutes, including the National Communicable Disease Committee, complementing the JEE by providing in-depth details on selected topic. On the other hand, the challenges in conducting the UHPR are as follows. It is a country-led activity with an unstable methodology. Clearer guidance and more preparation are needed. Partial understanding due to topic selection is another challenge. Some strengths, such as the epidemiological workforce and laboratory system in Thailand, were not chosen for UHPR, as several reviews and assessments had been conducted in these topics in recent years. Therefore, the UHPR cannot provide a comprehensive view of all components of public health emergency preparedness and response. In conclusion, the UHPR can complement other assessments and evaluations by providing a deeper explanation of strengths and gaps. It requires a stable methodology and support as a country-led process. For your attention.
A continuación, de acuerdo a la agenda establecida.
Next, and according to our agenda, we are going to leave the mic to Dr. Marilyn Roselin, and she's going to talk about the experiences of Central African Republic, the experience of the UHPR pilot. Go ahead, please. Hi, and good afternoon, everyone. Thank you very much. My name is Mary Roselin, as was mentioned. I am in the Central African Republic. I am responsible of the emergency preparation and international health regulations in the WHO office. Today, it is an honor to share the experiences of the Central African Republic in the Universal Health and Preparation Review. Next. If you could pass it to the next slide. As has already been mentioned in the Thailand presentation, in the Central African Republic, the review was implemented in 3 different phases. One is the preparation phase, the review as such, and the post-review phase. In the preparation phase, we did this at different levels. At a political level, we obtained the approval in the Council of Ministers. This was a way to bring from the beginning all of the government and the president. After, in the other phases, we also were able to obtain the approval of the Prime Minister. And in the country, the Prime Minister has a committee that is called the Technical Committee, where he meets with all the ministers and the United Nations system, civil society organizations, non-governmental organizations, and parliaments. So it was important to have the process pass through this committee. And after going through this committee at a country level, we also were able to obtain the National Crisis Committee that sanctioned or approved the report that we were able to obtain in this process. At technical level, we set forth the National Secretariat for the review that was done through the Prime Minister degree with the participation of 25 people that come from all of the different areas of society. That secretariat connected more than 147 technical documents that the experts analyzed for the review. More than 6 workshops were held during the preparation phase and later too, so that at a national level, we could get consensus on the results. The logistics was robust because we had to mobilize 20 international experts and At a national level, more than 450 participants in the different workshops or activities that were carried out during the preparation phase. And you must imagine that transportation of all of these participants was a big task for the country office and also for the Minister of Health. Next slide, please. In the second phase, and that is the phase of the review, the launch was done with the Prime Minister. The team had more than 10 advocacy meetings at different levels, for example, with the Minister of Finances and other ministers. They visited 5 sites of different kinds for primary, secondary, and tertiary levels. They do 2 simulation exercises. They interviewed 28 key informants in the country, and they also carried out many focus group discussions with more than 120 participants. At the end, the experts were received by the president to get a debriefing. Next slide. In the post-exam phase, post-review phase, we have done the universal review. We have finalized the report that was signed by the president of the country, and it is now available on the WHO website. We have updated the National Health Development Plan that is also signed by the president of the country, and we have updated the National Health Security Plan, that's the NAF in English. We have used all of these results for the review to create the operative plan. And it ended with an investment plan for health security. And we're currently using that investment plan for health security to submit a proposal to the pandemic funds. Other stages include our review that is being, our report is being reviewed at a national level. We also have a matrix of recommendations, and this allows us to do monitoring and evaluation because we established a cycle of assessments of the implementations of the recommendations of the review. Next slide. As added value for us, Dr. Stella has already mentioned some of them, but for us at a national level, this is the first assessment that aligned the health systems, health security, and universal health coverage. This review allowed us to get the high-level political commitment with the head of state, the prime minister, and the parliamentarians. All of this towards achieving health. The review allowed us to find a high-level national and international commitment. It allowed us to improve global solidarity for the development of national capabilities. Currently, we have many partners from other countries that have come to support the Central African Republic. Also, the review allowed us to strengthen the framework for implementation of the Sustainable Development Goals. As challenges at a national level, the report has 320 recommendations that should be implemented in 5 years. We are in a country that has had a long conflict, so mobilizing domestic funds is very difficult because right now we have a national deficit. Another challenge is to implement the nexus of human development that is fundamental for resilience in the health system. These are the challenges that we are trying to overcome, and we are working on those every day in the Central African Republic. This is all I wanted to share with you. Thank you very much. I'd like to thank the panelists from the Central African Republic. Now we will hear about the experience from Portugal from Dr. Paula Vasconcelos. Go ahead, please.
Good afternoon to all. Thank you for the opportunity of sharing our experience in Portugal and which as several other which representing European countries in UHPR. Can you put up our presentation? Thank you. Well, what we would like to underline is that Portugal's commitment with WHO began in November 2020. At that time, we did not know that we would be in the pandemic, and we perceived that a more adequate evaluation, not only for our emergency response and also for our healthcare coverage services. So we coordinated the Ministry of Health and the General Direction of Health, which reached a commitment to pilot UHPR in Portugal, considering that political support was ensured despite general elections. So technical preparation. Our preparation was directly articulated with WHO in Geneva and Europe. We engaged with several different national sectors. People were very sensitized to the pandemic, so we received contributions from different sectors, and it was a challenge to, within the dates that were set for visitation and our country's responsibility, we calculated that we had several months of involvement, but we had 4 months to prepare, after all, for the major, more important visit. Within the programs for the visit, which was mainly supporting work groups and simulations, were booked 1 month in advance. We're going to leave this slide. I just wanted to say 2 or 3 things over the following slides. I just wanted to say that Portugal involved roughly 80 participants from several different sectors, and for us it was very important to involve the parliamentary group, and it was the first time in which there was a concern in coordinating of our parliament's healthcare committee with a WHO visit to Portugal. So let's go through the other activities. Next slide, please. Just understanding what has been important for us. We're still at a point in which we're looking at lessons learned from COVID. Therefore, these lessons learned helped us understand there is much to change, especially for some strategies or national plans. So UHPR has allowed us to understand the next steps. We were able to discuss UHPR with several other European countries, and we also took part in discussions regarding UHPR in WHO Europe and Geneva. We contributed to a white paper in which we discussed the importance that UHPR may have. We are still at the point of understanding with other countries how to carry out the peer review, but we would like to say that UHPR was a national and subnational opportunity to bring visibility to what we do to a global perspective. We had a very important participation of subnational partners who were able to show what they do for public health emergencies. And we saw how Portugal, who is a small country in comparison with other European countries, how we may contribute not only for global projects, but global instruments. In this case, the evaluation instrument itself, in which our technical contributions had a certain influence in the document review. As we all knew, it was piloted in our partner countries who are in this discussion today with us. It was an important moment to stop and think. There was a large amount of help because everyone was thinking about the pandemic, and we had to think about what that meant in terms of human resources, tools, and others. So therefore, it was an opportunity to know the lessons learned from COVID and try to determine how they can be sustainable. How we were able to quickly engage to answer COVID, how that can help to answer future emergencies, and how to align healthcare so they understand the added value that healthcare initiatives may bring. So let's move on to our last slide and let's wrap our presentation. So the recognition of the WHO of our best practices was very useful and important, and it has also been very useful when we receive visitors from other countries and for our partners in the European Union, and acknowledging that many things that we had in our Portuguese legislation have helped to facilitate and have been shown flexibility to answer health emergencies. Just like our other countries, we are expecting the second part of the review. We would also like to be a country that may host and discuss with other countries to understand UHPR as an assessment and evaluation instrument to review the country's capacity of answering to national and global challenges, and also understand the challenges for some national changes that must be done in terms of strategies and techniques. Unfortunately for us, very few from the legal point of view. I am available for any question or discussion on any aspect that may be important to share about the dynamics of the logistics and the challenges that we still have of how to continue and better organize what was a group effort of 80 people from different sectors who were with us. The next slide is just pictures, so you can see the dynamics of participation of different sectors, visits, the interviews.
Thank you so much to our presenter from Portugal. And this ends presentations from countries that have collaborated with UNHPR experience. We would like to open the floor to questions. You may raise your hand or type your question via the chat so that answers or remarks can be provided. The floor is yours to whomever would like to ask.
Se não tem perguntas, quer dizer que eu fui muito clara. Isso é bom sinal.
So if there are no questions, this means I was crystal clear, which is
Thanks
a good
so much.
sign.
I have a question, perhaps, which on some sessions that we've had with our PAHO neighbors. And Estelle also mentioned this somewhat during her presentation on what the added value that this mechanism or tool provides comparing to other existing instruments. JEE, or the voluntary assessment based on SPART that is performed in the Americas region, or any other kind of instrument that countries have regarding assessment of capacities for emergency preparedness. So this would be the question for our PAHO colleagues. What is the added value that HPR provides comparing to other instruments in the country?
Desculpe, a pergunta para Portugal, nós podemos responder. Muito bem.
Of course.
If the question is for Portugal, we can answer. In our understanding, the way we understood UHPR is a complement to other instruments that were already known in the preparation and answer for public health emergencies. Therefore, the complement for health safety is in the it goes down the pipeline of healthcare and healthcare with an instrument of collaborations with with society. These two pipelines are not very specific, nor are they touched upon in the joint external evaluation or in the after action review. We believe that UHPR brings, well, it actually goes beyond the merely technical components, and it tries to bring in a political commitment component, and it brings the segment of health in terms of public health management that permits us to bring together to obtain better health information, not only for health emergencies, but also about how prepared our services to answer these emergencies. So in terms of preparedness, so as a pilot, it can try to improve this area of integration of all that is important in public health management. We understand public health management as the management of emergencies, or not only understanding the magnitude of these phenomena, but also their importance, everything that society and the community's perception of this, but also the validity of the system in which we understand what is my situation, my preparedness as a public health system to answer to these public health emergencies. And we can also say other instruments can complement these areas during the visit. But we believe that UHPR, as presented, brings these issues together in an integrative manner. It does need a few touch-ups. Portugal has suggested a few reviews of these areas, so it can bring together this integrative aspect.
Thank you so
in
much,
public
and go
health
ahead, Dr.
emergencies or menaces.
Marie Rosaline.
Paula se ha dicho. Yo pienso, uno, lo que hay que ver es que hasta ahora no hemos tenido una herramienta que tome en cuenta el sistema de salud, la seguridad sanitaria y la cobertura sanitaria universal, porque siempre hemos tenido de disecar como si fuese el sistema de seguridad sanitaria es diferente del sistema de cobertura sanitaria universal. Mientras tanto, cuando hay una emergencia, es ese mismo sistema de salud que debe de responder no solamente a la emergencia, sino también de continuar a proveer todo lo que necesita la población en términos de salud. Entonces, este punto que trae el UHPR es muy importante de que nosotros en salud pública empecemos a considerar el sistema como un todo. Lo que también ha dicho Paula y que quiero insistir es el nivel político. Siempre hemos tenido que hacer las evaluaciones a nivel técnico, a nuestro nivel, pero nunca tenemos una herramienta que coja que vaya a ese nivel político hasta tener el jefe de Estado que pone su cuño, que firme para decir, yo me comprometo a que todas esas recomendaciones se ponen en marcha en mi país para mejorar el sistema de salud. El otro punto también que es muy importante es esa solidaridad a nivel nacional, internacional. A nivel nacional es la primera evaluación con la que hemos reunido toda la sociedad. Hemos tenido que tener reuniones con los parlamentarios. De hecho, esa plataforma sigue funcionando. Con la sociedad civil que discuten, con la comunidad. Hemos puesto lo que se llama un diálogo comunitario con más de 312 miembros de la comunidad que viene a informar a los políticos. Eso es lo que pasa en la comunidad que debe de tomar en cuenta en esa evaluación nueva que estamos haciendo. Otro punto también es que el UHPR sobre todo en el caso de
Another point also, especially in the case of the Central African Republic, where we have a country in conflict with a humanitarian situation of more than 30 years, we have many international and national partners, but everyone is working on their own. With UN and UHPR, we have been able to join them together. Recently, we have set underway a mechanism for coordinating health affairs, where everyone brings in whatever they have obtained in order to develop the healthcare system, be it at the humanitarian or development levels. We have built a full plan, and we are working on a maturity level, which is called a plan, a budget, and a report. That is more or less what UHPR has brought to the Central African Republic. Thank you so much. Thank you so much, and go ahead, anyone who would like to present questions or remarks.
Mediante el chat, yo recibí una pregunta y respecto al tema de indicadores. Un aspecto que se requiere preparar.
I received a question via the chat regarding indicators. Something that should be prepared for the in-person mission is the country feel, and this includes many indicators, some directly related to emergency management, others are not. So the question I would like to propose based on this is, how have the countries handled the issue of compiling and organizing the information in order to respond to these indicators that were part of every country's profile? Go ahead, please.
Puedo empezar y luego otros países, bueno, Paula puede añadir si desee. Bueno, primero lo que he dicho es que hemos puesto en marcha.
Well, first, I can answer. First, we have set underway the National Secretariat of UNHPR. That secretariat was included a conceptual note and all terms of reference on what needs to be done. And one of those points in its terms of reference was precisely compiling the information. First, we have checked the archives to check the last 5 years, what have been all reports and plans, anything that has been developed at the national level with all partners. As I mentioned, we have many partners in the country who are working in supporting the Ministry of Health, and this is how we have reached every department to recover all documents they have issued. What we did not find, we have tried searching for with people who are still involved with the system and have memory of it, and we have reached national consensus. We have held actually many national consensus workshops. The first national consensus was regarding the documents we had found. This is how we have collected 147 documents. Now, this information needed to be organized because it was disparate, non-standard. So the JEE, we have employed it much because we have also developed a checklist or a template where we have entered all information we need on the country profile, especially, for example, with regards to universal health coverage we have had, what are the numbers of physicians we have and whether the population has increased. We have compiled all this information on an Excel that we call fact sheet, where we have put in all that information and shared it with the team who was in Geneva, with which we also had sessions every 2 days to prepare. The Central African Republic was the first country that did the assessment. We have also been learning and putting underway. At the same time, we have been learning. Perhaps now there are different ways of doing it, but at its time when we did it, that was the method we applied. Thank you so much.
Muchas gracias.
Thank you so much.
Pregunta en el chat,
There's a question via the chat from Argentina
respecto a Tailandia,
regarding
se refiere
Thailand,
a limitados datos
referred to
epidemiológicos
limited
en los
epidemiological data in
que
the
consideran respecto
UHPR
a los
assessment.
dos países
What do you consider regarding the
limitados datos
2 other
epidemiológicos,
countries regarding these
Tailandia.
limited epidemiologic
Doctora María o
data?
Paula, quien
Go
desee.
ahead, Dr. Maria or Dr. Paula, whoever wishes to answer.
Por favor, ¿puede repetir?
Please, can you repeat? Apologies.
Tailandia
Thailand,
refirió en su presentación
and
a
during his
limitados
presentation,
datos
referred
epidemiológicos
to
en
limited
los
epidemiologic data in UHPR
¿Qué
assessment.
al respecto?
What do you consider regarding this epidemiologic data?
Não é bem indicadores de resultados.
It's not exactly an indicator of epidemiological results. The UHPR indicators may have some epidemiological information if eventually they are considered, for example, priority diseases for that country. Therefore, some indicators are already extracted from other sources of information, and they may, let's say, bring a perspective on the global or regional median, depending on the area corresponding to the different regions, which also helps the country to understand its global position, if I understood the question. Therefore, it's not epidemiological indicators, classical sense, but they are indicators for certain areas, whether for healthcare or regarding the answer to certain phenomena which the country believes are priority. For example, in Portugal, obviously, some of our priorities may not be the same as the priorities in other countries, but some indicators for UHPR are intended to be standard to help alignment and data harmonization between countries. Just to give you an example, the data for what the country believes is priority have to do with the main reason for death or disease. Within that, also the determinants related to a higher morbidity or mortality. What we believe is that many of these indicators must be a bit more worked on to reach an harmonization of indicators so it can be a global instrument versus what is important for the country. So UHPR itself can help this approach if it is integrated in the review process. I don't know whether I answered clearly, but we could try it otherwise. Thank you.
Quizás puedo añadir algo a lo que ha dicho Paula.
Perhaps I can add something to what Paula has stated. I believe that epidemiologic data that we're referring to are perhaps this data that we are collecting regarding the country epidemiologic profile, which is for infectious diseases or non-infectious disease. And as Paula stated, it will also depend on the indicator that the country wishes to consider. For example, in the Central African Republic, we have considered to show the level of the healthcare system, the tuberculosis indicator, and the HIV indicator that we considered, and that data exists because these are national programs that exist which connect the data that is analyzed, and we had to employ the existing data in the country up to 1 year or with 2 years delay, but no more than 5. Now, regarding epidemiologic data of infectious diseases, we have used epidemiologic data that we have, especially those on outbreaks that we currently have. That's what we have employed. And we have also used regional level data that could corroborate the level that we have in the country. The comparison we have used much is the comparison of the 19 areas in the international sanitation guideline at the country level, at the regional level, to determine at which level we are at the region level, whether we are below or above the regional level. All that data we have employed in some way or another. Bill will tell you that the data that is had is at the data at the country level. It is not done as an assessment at the time of UHPR. UHPR will correct the data that already exists at the country level. This is what we have done to perform the UHPR in the Central African Republic. Thank you. Thank you so much. I see a hand raised from Dr. Paula. Go ahead.
Thank you, Marie. I think you also helped to clarify these ideas. In Portugal, just to give you an overall idea, we chose, for obvious reasons, AIDS because it's a priority program, and tuberculosis. Considering the European target of diminishing tuberculosis as a disease in our region. These were the infectious diseases which are important for us, considering they are priority programs. This means that there is financial investment of our own resources for strategies and specific interventions in the prevention and control of these two infectious diseases. The same strategy we also use for community programs for non-infectious, non-transmissible diseases. We also use the data for oncological diseases, cardiovascular disease, and mental health. So these were the 5 main areas for which the epidemiological indicators were used to better characterize and have a better understanding, which further deepen the UHPR qualitative area to better understand these programs and the interventions we affect in these areas. Thank you.
To respect, for time constraints, we will give way to Dr. Samira Smart from the Pan-American Health Organization so she can define what follows from the global perspective regarding HPR. Go ahead, Dr. Samit.
Thank you very much. Can you hear me?
Yes. Yes, we can hear you.
Great. So, Excellencies, distinguished member state representatives, first of all, sincere thanks for taking the time today. I also want to acknowledge the presence of our colleagues from the Central African Republic, Thailand, and Portugal for generously sharing your experiences, very frankly, as you have piloted the Universal Health Preparedness Review. Finally, I want to thank you, Ciro, for your personal leadership in bringing us all together today. Colleagues, what we are bringing to you is the experience we are gaining as we are building the knowledge base for the Universal Health Preparedness Review. As you heard, that this is truly a member state-led process and voluntary. And we are building the evidence and gathering the pragmatism by sharing the experiences from the pilot exercise. And we will have a full picture of UHPR after we undertake a global peer review for the 4 pilot member states in the coming months. And we all will have an opportunity to, in a transparent way really review those experiences, the good, the bad, the improvements all together. But the bottom line is that at all levels, what we need is a rapid and a robust response to any health emergencies based on the foundation of cooperation, trust, sharing experiences. And this is what you have heard that the spirit and the principles of the Universal Health Preparedness Review presents. And most importantly, this also is an incentive for member states and the global development and multilateral agencies to have mechanisms in place to provide the resources as soon as the gaps are identified and recommendations are proposed. And this is what we heard from the Central African Republic, potentially accessing the funds from the pandemic fund. And similarly, we have heard from Thailand that there is potentially a legislation for Pandemic Preparedness Act in consideration. And we didn't hear from our colleagues from Iraq, but the UHPR experience has led to a long-term 10-year plan, not only looking at health emergencies preparedness, but the foundation of what defines a solid preparedness and response to any health emergency by strengthening the entire health systems, including response to climate change. So PAHO has truly a long and a very strong history of accountability and monitoring systems. I personally have had the experience working with majority or all of the PAHO member states. And the unique feature that the PAHO member states bring is the focus on equity and resilient health systems. And we believe that there is an immense opportunity to learn from the experiences from this region as well. So going forward, the steps are very simple. We are building this as we are learning. So the first is we will complete the entire planning cycle of the Universal Health Preparedness Review by completing the peer review, which will be soon after this World Health Assembly in May. We hope you can join, and we hope you will offer your insights and your reviews to the 4 countries and collectively to the global universal peer review. The second is we are documenting the experiences as you have seen from the pilot reports and synthesizing what are the best practices or those that we ought to avoid as every country begins reflecting on the post-pandemic era, as well as being prepared in a dynamic way to respond to any health emergency. So that evidence base is becoming available on the website, as you see. We are also cognizant that we shouldn't be adding another layer of peer review, given, as you heard from Mike and Stella, that many countries and almost all countries in PAHO have done the SPAR or any form of JEE. So we also, as you recall, have the SDGs that all countries are committed to report on by 2030 and the triple billion targets, which really help us accelerate progress towards the SDGs. When we look at each of the triple billion targets and the underlying indicators that have all been organized and compiled, let's look at the health emergencies preparedness review. We have the preparedness drawing from the international health regulations. We have the prevention through vaccine preventable diseases. And now we also have, thanks to you and your advice, to have a dynamic metric of rapidly detecting and notifying and responding to any outbreaks and health emergencies. Let's look at the Universal Health Preparedness Review. Indicators were already discussed, whether it is HIV, TB, or any of the non-communicable diseases. Again, pandemic has shown us how important health systems are to deal with, as well as the underlying health conditions in response to COVID-19 as well. And finally, the healthier population index and the indicators that fuel the healthier population index, such as water and sanitation and hygiene, very important during any health emergencies. We also learned that mental health is extremely important, that the region particularly is also advocating for. So these indicators and these metrics are already all available. So we will be compiling all of these in an easy to access format and making that available as well. And it will be truly up to the member states to define what the future pathway is going to be for UHPR as the conversations happen during the INB, as well as updating the IHR regulations. So from the Secretariat side, as you heard from Mike, and also from the regional office and all the regional offices together, we are here to listen and to support and respond to the needs that you would ask us to take forward. So we look forward to hearing your feedback, your recommendations as we build this together with you and through your priorities lens. So with that, I thank you, and we look forward to seeing you again soon during the World Health Assembly and after, at the peer review. Over to you, Ciro. Thank you very much.
Thank you, doctora Samira, for su presentation. Para finalizar esta reunión, simplemente, en primer lugar, agradecer.
To finish this meeting, first of all, I'd like to thank each one of the member states that has participated, and each one of the participants. I'd like to thank the WHO and the UHPR Secretariat for supporting us with this meeting. And simply now we're going to share all the information that we have about UHPR. Please go to your country offices if you have any doubts or comments or you require more information. We have the UHPR information in Spanish, French, and English. And remember that at a regional level in PAHO, we're committed to providing support to those countries that voluntarily would like to take this universal review. We have a technical team that helped us organize this event. We are in the System Services Department. We also have the Department of Communicable Diseases Control, and then we also have the Social Determinants Department and emergencies, so that we can help the countries and offices that are interested in learning more or using the UHPR. Now we go with Dr. Ciro Ugarte so that he can close the meeting.
Thank you, Samira, my colleagues, member states. It's a great pleasure to see you, Samira, as always, because you have been a champion in this process and also looking for the avenues to link several other initiatives of WHO and the member states, crossing barriers of disciplines, but also institutions, and also looking for the best for our member states, because at the core of our work, as you know very well, is the health of the peoples in the world. And in our case, we're looking for a healthier population in the Americas. So having at the center of that review our member states and looking for their intervention, the adoption of the useful tools that will complement other efforts worldwide And at the end, as we mentioned previously, where at the beginning, when Mike also introduced the HQ vision of this, we are looking to have member states stronger from the local level to the national level and fully engage at the global level on many challenges that we still have, okay? I don't see any changes unless we work together. And the negotiations of the international negotiating body, but also the proposals of amendments of the IHR and other work streams of the member states, we are looking more and more our member states fully engaged in the processes. At the same time, we are seeing an increase of tools and avenues, and sometimes we get lost. And it is extremely important to have also the countries prioritizing how they are moving on, and having this tool, this useful tool, this peer-to-peer evaluation as another avenue to help them get stronger. And I cannot thank you more on your presence, your support, and also to highlight this continuous joint venture with our regions, Amira, Mike, Stella, colleagues, because this is truly, truly beneficial for our member states. Thank you so much, and I wish you the best. Thank you. Take care. Thank you, Mike.